If you're trying to find a new doctor that offers different care and payment service, today we look at some of the options for local patients. Joining us is local physician, a primary care specialist, Arencibia, with the Tulane Doctors Center for Longevity and Wellness. Thank you so much for joining us.
Thank you for having me.
Appreciate that. Healthcare, always a big topic. There's so many different things that are happening right now, and it's changing up a lot. We know of the traditional system, right? You go to the doctor, they go through your insurance, they make the payment, but you're doing something called direct primary care. Tell me about the pluses and the negative, perhaps, with that.
So direct primary care is a consumer-based approach to a model of primary care, which is sort of a spin-off of a hybrid called concierge medicine, which is also something we practice in our office as well. And in this model, what it was really focused at was trying to help a population of patients that didn't have insurance or had high deductible insurance, and most importantly for small businesses that didn't have an opportunity to provide a health benefit to their employees.
So if you are a person who wants a place to go, but your deductible is so high, I mean, who is the sort of the key target you're targeting with direct primary?
As far as a patient population? Yeah, I mean, that would be a population, patients that, have high deductible that are still paying out of pocket. Since it's a consumer-based approach, the other part of this is that since we don't bill insurance, we just charge a flat monthly fee, which is very affordable. And the other thing that it affords is that we help negotiate cash pay pricing for labs, imaging, and sometimes even with certain specialists that want to participate in that type of model.
And that's the key word, negotiating, because people are trying to look for help with those prices. What may be the negative for someone who may not fit that model?
So the negative, number one, is if you have health insurance, especially that's paid for by your employer, then it doesn't make sense for you to pay for a membership fee. The other is that if you run into trouble, where you get sick or need to see a specialist or have, very specialized medications, none of this is going to cover that. This is really just strictly for primary care. In fact, it's not even health insurance. Okay. So we oftentimes remind them that we advocate for them to still look for some type of health coverage for catastrophic illnesses.
Okay, talk to me about the concierge doctor's concept and who that caters to, the good and the bad of it.
So the concierge is, again, it's a model where you have a membership practice, very similar to a fee-for-service practice, the traditional model. The difference is that in this model, the doctor has a very small panel of patients. You get the opportunity to have same-day, next-day appointments. And typically, concierge doctors also seem to specialize in doing functional medicine and alternative medicine therapies and those types of things.
And it seems for your patient with direct primary and concierge, you go to the doctor and sometimes you feel like, some patients feel like they're rushed. You seem to stress more on spending more time and then focusing on not just whatever is ailing you at that moment, but long term to keep you healthy. What's hurting you to keep you healthy? Talk about that.
So I love this part of this because it's interesting. I've come to realize that I'm more of a glorified care manager, and I really take the approach of, especially on the front end, trying to spend more time so I get to know the patient and set up a roadmap for their health care for the rest of their life.
That is amazing. And how can people get more on this if they want to look at these options, the traditional, the direct primary, or the concierge one?
So obviously you can go on the internet and search for them, but two sources. You can email us at Center for Longevity and Wellness at tulane.edu or go to the website Louisiana Direct Primary Care Coalition.
Well, there's definitely a lot happening, and people are looking for different ways to try to figure out how to work around all of the costs. So I appreciate you sharing what is happening locally.
Thank you.
Appreciate it. Thank you, Dr. Nakandra.